You are live now.
A very good morning, ladies and gentlemen, and welcome to our master talk on hair care in the current scenario. आप सभी का स्वागत है इस मास्टर टॉक लाइव सेशन में। मैं हूं आपकी होस्ट दीप्ति हरवानी and today we shall be talking about hair care management. Our hair is our crowning glory. It symbolizes our personality and tells people so much about us. Having strong and healthy hair can indeed boost our confidence. So it's very important to protect our hair and keep it looking gorgeous every single day in all seasons. Today we shall be talking about looking after our hair from the roots to the ends and how we can manage our hair better to keep it looking healthy and shining. And joining us live from Chandigarh is Dr. Roma Pandhi. Dr. Roma Pandhi, MBBS and MD, is a leading consultant dermatologist at Pandhi Hospital, Chandigarh. She is the Vice President of CDS, Chandigarh Dermatology Society, a member of Association of Cutaneous Surgeons India, Cosmetic Surgeons of India, the Indian Women Dermatology Society. She's also a member of Pigmentary Society of India and the Indian Medical Association. So, welcome, Doctor, and thank you so much for joining us on this live platform.
Thank you, Deepthi. And at the outset, I would like to thank IPCA for organizing this session. Actually, the perfect timing. We're right in the middle of monsoons, and hair problems never get an end during these weathers. So I guess we can start with the session, and I'm hoping at the end of this discussion, I will be able to sort out quite a few common problems which we all face when it comes to hair care and hair loss.
Absolutely, Doctor. Once again, thank you for joining us. And our viewers indeed are really looking forward to hearing from you. So हमारे viewers जो हमारे साथ जुड़े हैं वो काफ़ी उत्सुक हैं जानने के लिए हेयर केयर के बारे में. So शुरुआत करते हैं डॉक्टर. One of the most common hair concerns facing people today of all age groups is that of hair loss, doctor. So could you please tell us what is considered normal hair loss and when should we get really concerned about hair loss?
There are two terms when it comes to hair loss. It's never just hair loss per se. There's something called as hair shedding, and then there is something called as hair loss. So when we mention about hair shedding, it is about losing our normal hair, and the normal is different for every person. Some person or somebody could have hair loss of up to 5 to 10, and it could be normal for them because it's happening on a regular basis. But for that same person, when the hair loss increases, sorry, the hair shedding increases to about more than 50 or 100 per hair per day, then that's not normal for that particular person. So the hair shedding is something that can happen because of multiple various factors, and that is what we call as effluvium, and in medical terms it's also called as telogen effluvium, and that's hair shedding. So on an average, according to our American Academy of Dermatology, we could have a hair shedding of up to 50 to 100 strands of hair per day, and it could be accounted as normal. So we shouldn't be getting alarmed. But yes, if we don't have it on a regular basis and suddenly if we start losing that kind of a hair, then that's accountable. That's definitely needs treatment and consultation. Then we have something called as hair loss, which you earlier mentioned. So hair loss is again for varied reasons, and that happens when there's a sudden arrest in our hair growth or in our follicles, and when we stop growing new hairs on an average, and there is already a shedding associated sometimes with the hair loss, or there's just hair loss in general. And that phase of our hair loss is called as, or losing hair is called as anagen effluvium. So that is when anagen, which is a growing stage of our hair, is halted for some reasons.
Well, thank you so much, doctor. Doctor, what are the general causes of hair loss?
So when I was mentioning earlier that there's a hair shedding and a hair loss, the hair shedding has its own reasons. So hair shedding could be for reasons of like coming out from an illness, or which is a prolonged illness in terms of any of these fevers whether it could be dengue, malaria, typhoid, or any kind of other stomach illnesses which are really prolonged. Or it could be because of postpartum, which we call post-delivery hair loss, hair shedding. And then it could be because of using the wrong cosmetics on the hair, or weather changes sometimes also lead to hair shedding or excess of hair shedding. So these are the common causes of hair shedding per se. And we have common causes of hair loss. When we talk about hair loss, it's the anagen effluvium I'm saying, and when there's an arrest in the hair growth or in the follicular growth. And that happens because of when the roots are exposed to a certain drug, like when we say chemotherapy, patients who have undergone chemotherapy, post-cancer treatments, in terms of even radiations received for as part of cancer treatments, can lead to sudden arrest in our hair growth because of the medicines or the radiations the roots were exposed to in that particular time. And in terms of anagen effluvium, other causes could be when there's a certain traction or pull on the hair. A constant pull, which has been happening over years, can also lead to a hair loss in that particular area or that particular patch of hair. And then so these, I would assume, are the common reasons. Of course, there are other multiple factors which could be more deeper and deep rooted. But for general population, these are the common factors which can be addressed to, and they can visit a dermatologist if they're very alarming.
Right.
In terms of hair, when we talk about hair shedding, we say that the hair shedding usually not associated with any kind of symptoms. So in terms of itching or irritated scalp or rashes, hair shedding is generally not associated with these kind of symptoms. Hair loss sometimes can be, cannot be, and sometimes they can be both clubbed together. The patient or the person can have hair shedding as well as hair loss.
Okay.
For the same reasons, maybe at times.
Right. Thank you so much, doctor. And doctor, can a person's lifestyle play a role in hair loss?
I think lifestyle, when we say, is like a very broad term. Lifestyle could be related to diet, could be related to our exercises routine, could be related to our the amount of hair hair procedures we make our hair go through in terms of coloring, or in terms of straightening or rebonding, in terms of perming the hair. So lifestyle is not just about how we live, but what all we are going through in our life on a day-to-day basis. So firstly, yes, diet. A healthy, balanced diet never goes wrong, which has high amount of protein and equal balance of your carbs and fats. Adequate amount of water, fluids throughout the day. Yes, so healthy diet and lifestyle does help in the hair growth and maintain healthy hair and roots. When we talk about exercises, I believe exercises have a big role when we come to healthy hair growth, because any exercise routine always releases what we call as happy hormones, or the endorphins. And these endorphins actually bring about a lot of circulation around the roots, which actually adds to a lot more growth or healthy growth. So yes, exercise is again helps in our lifestyle routine if we incorporate it in our lifestyle. And not exposing our hair to very frequent hair coloring, or not exposing our hair to these rebonding or restructuring of our hair in terms of perming, and regular hair, not using hair dryers or hair blowers on a regular basis. So in these ways, and of course sleep, we cannot stress enough on that, healthy sleep pattern. So these all things in combination work together to improve the hair growth or the quality of our hair.
Right. Thank you so much, doctor. Doctor, you mentioned diet. So could you please elaborate a little bit more on how can diet cause hair loss, and how can a good diet combat hair loss?
Nowadays, actually, I've seen that people just want to lose weight all of a sudden. And that, of course, is definitely not helping in any of our hair growth or hair loss factors. So we need to make sure that if we do want to go on a diet, it has to be a very balanced, I would say, like we say on a regular basis, we need to take a healthy, balanced diet. When we go on dieting per se, we need to also have a very balanced proportion of everything so that we are not missing out on micronutrients, things that we don't think of, like zinc, maybe selenium, B12. These are nutrients which are actually needed for any kind of hair growth or rejuvenation per se. So we tend to miss out on some of these factors when we go for crash dieting, or we suddenly want to have a weight loss or reduction in our weight. So my advice to people going on dieting would be, yeah, it's okay to go on dieting, but crash dieting is strict no. And you can consult a dietitian. Maybe they would incorporate everything in your diet so that you're not missing out on nutrients which are genuinely needed for hair growth. And also I would advise that always take adequate fluids and liquids in whatever form you can take throughout the day in your diet, and it has to be more or less depending upon your profession and your workout routine.
Well, thank you so much, doctor.
So one more point in that, I would say, yes, proteins are a big part of diet. Hair is all about proteins, and you should definitely be always taking a high protein diet whenever you are into hair loss issues.
Right. Thank you so much, doctor. Doctor, talking about head wash or a head bath, are there any do's and don'ts? Would you like to share any tips, in your experience? Maybe there are some things that people are doing wrong when it comes to washing their hair. So could you please share a few tips with us?
Yeah, so actually, there are a lot of myths people carry, or I would say a lot of mind blocks people have regarding hair wash and what shampoos and what conditioners and how often and what should be the temperature of water. So first of all, coming to the temperature of water, yes, I would say very hot showers strictly avoid. They definitely dry out the roots dry out the hair right from root to the tip. So that's a strict no. Try and take lukewarm baths as much as possible. Secondly, about the shampoo, what kind of shampoo should be used? I always advise my patients, and in general, I think everyone should be using shampoos which have a minimum of chemicals and which have no sulfates in them and no parabens. The reason why we advise patients not to use sulfates in their shampoo routine is because sulfates tend to break down the hair, make them very weak, and there is breaking mid shaft or mid length because of the sulfates, because they weaken the bonds in the hair, the keratin bonds in the hair. So yes, sulfates are a strict no if you're picking up a shampoo over the counter. And now, as far as conditioners, I believe conditioners should always be added to your shampooing or hair wash routine, because conditioners in general have a protective effect over the length of the hair. Our shampoos and water, or maybe the pollution or the environmental weather changes, they make our hair go through a lot of trauma on a day-to-day basis, which we don't realize. So conditioners, I feel, are akin to like sunscreens, which we use to protect the skin of our face. The conditioners are needed to add it to your routine for the hair wash, so that you're protecting them from the external agents of pollution and dust and weather changes. And conditioner could be any. I'm never really particular about what conditioner the patient uses, depending upon what kind of hair they have. If they have very dry, frizzy hair, maybe they can add a little more moisturizing conditioners. So conditioners can be picked up off the shelf. No really particular barring advices as far as conditioners are. But there's one advice regarding conditioner is that please never use conditioners into the scalp. They have to be used only in the length, because conditioners are heavy and they tend to block the follicles and the roots, and the hair cannot breathe at times because of these heavy conditioners, which can in turn lead to many other issues about hair loss. So that was about the conditioners and shampoos and the water temperature. Now, the third question is about how frequent we should be washing our hair. So hair wash frequency could be, on an average for everyone, it could be 3 to 4 times a week. But again, depending upon your profession, your what kind of profession you're into, where you're exposed to a lot more dust and more pollution, then maybe the frequency can be increased. Or if you're working out or you're exercising and you're sweating a lot, of course you should have the frequency of washing also can be increased. If you have a very oily scalp which tends to attract dandruff, or it tends to be very sticky, you can again increase the frequency. So if you ask me, average 3 to 4 times a week, but you could increase the frequency depending upon what kind of hair you have. And yeah, so I guess these are the 4 points which need to be addressed as far as hair care is concerned. Now, oiling is one thing which people always ask me, whether we should be oiling our scalp, and whether we should be, how long should we leave the oil in, what kind of oil we should use. So as far as oiling, there are 2 schools of thoughts. Some people believe that oiling is not good, it's not necessary, it blocks the follicles and it does not let the hair grow out very well, or it could lead to, what we call as folliculitis. So some people are against oiling, whereas we have some people who favor oiling. I am the person who favors oiling because it can be used to condition the skin of the scalp. The scalp skin sometimes tends to be very dry, and it can get dehydrated because of the frequent shampooing, or because of our frequent use of hair colors and hair cosmetics. So oiling in a way conditions the scalp, because on a routine basis we are only conditioning the length of the hair, the scalp still remains dry. So we can try and oil our hair, but the main part about oiling is that you need to remember it has to be done maybe just half an hour to 45 minutes before hair wash. Never leave your oil in overnight, because that definitely will clog your pores. So try and use lighter oils. Don't use very heavy oils. So something like maybe a coconut oil, or maybe something like a light olive oil, or a little bit of almond oil mixed with it. So you could play around with your oils, but they have to be left very light and left on only for about half an hour to 45 minutes before your hair wash. So yeah.
Well, thank you so much, doctor, for sharing that elaborate routine for head wash. I'm sure the viewers really got a few tips there. Doctor, coming to stress, of course, needless to say, given the times that we are in, there is a lot of stress on people overall generally. So, could you talk about that and its effect on hair loss?
Okay, so that was a good question, Dipti. I think I missed out on stress when I was talking about other things. So yeah, stress is a big factor when it comes to hair shedding per se, not the hair loss, but hair shedding. Now, what happens is, when we talk about stress, it's not only the physical stress or just the mental stress, is usually a combination of both. But yeah, either one on its own can also lead to hair shedding or increase in your hair shedding, and which can get very alarming at times. So trying to stay de-stressed in terms of mental stress, when we talk about trying do activities which keep you de-stressed. So like I was mentioning earlier, exercise. So exercise is a very nice way of staying de-stressed, because it actually releases a lot of happy hormones, and it makes you increase your blood circulation. So it does keep your roots and your body de-stressed. When we talk about physical stress in terms of having any illness, for prolonged illness, and whether it could be just a plain fever, or it could be fever associated with other diseases. So that's a physical stress on our body. That, of course, cannot be really avoided, because you have the infection, so you have it. We can only treat it and do away with it. But while you are having these physical stress issues, you need to be very supportive about what you eat and make sure your diet is very healthy. Because when we fall sick, we tend to avoid things, ye nahi khana, ye nahi lena, wo nahi pina. But I on the other hand believe that when you have a physical stress on your body, you need to let your body cope up better by eating well, eating balanced diet, and always keeping your diet on a high protein, and taking enough fluids. So these are ways of coping with the physical stress and avoiding the hair shedding from your hair going into a telogen effluvium, is what I call. And even mental stress, I already advised that maybe regular exercise routine. It could be just your regular walking or regular walks in the parks, or listening to music, or going for yoga session, or going for your gym sessions on a regular basis. So these are ways of avoiding mental stress, which in turn help us in avoiding the telogen effluvium phase of our hair shedding.
Right. Thank you so much, doctor. Coming to COVID-19, doctor, have you seen in your experience in the last 2 years that there is a correlation between COVID-19 and hair loss, doctor?
Yes. So the COVID hair fall, initially everyone used to think, no, it's just, it's a myth, but it's actually a reality, which we are going to have to face. And I think lots of patients are already facing. There are, I believe, 70 to 80% of patients who have had COVID, even to up to a mild degree, would experience hair fall at some point of time. And this kind of hair fall is what I was mentioning earlier, because of a brief period of illness, is called as telogen effluvium. But the good part about, and it usually starts within about 2 to 3 months of the COVID episode, and could last up to 3 to 6 months, depending upon the intensity of the viral load the patient had while he was having the COVID. So whenever these hair roots, they go through this brief period of illness, they go from their growth phase, which is the anagen phase, to they shift to the telogen phase. So because of which we experience a lot of hair fall, and which is 100% reversible. We can help the patient or make counsel the patients to eat well, make sure they take a very high protein diet, they take good amount of micro and macronutrients, take good amount of fluids. So these in turn help in the hair growth over the next 3-4 months post COVID, and can reduce our telogen effluvium phase, and can help our roots regrow better.
Right. Thank you so much, doctor. Doctor, coming to another hair concern that people face is that of dandruff. So could you please explain to us if dandruff is in any way related to hair loss?
Dandruff is it's basically a disease, because it is an infection, and it's a fungal infection of the scalp. It tends to persist in some patients, and some patients is just a phase, and we manage to get patient rid of dandruff. So because, like I said, it's an infection, it would require treatment. It would require proper dermatologist consultation. Most of the time, what patients do is, with dandruff, they just pick up any anti-dandruff shampoo off the shelf and they use it. And for a while, the dandruff might go away for a while, then come back. In the meanwhile, they give it to another 10 people at home. So I believe dandruff is actually a serious issue. It should not be taken lightly. You should visit your dermatologist. Maybe they can really sort out your dandruff problem for good at times. And we need to make sure that our scalp stays healthy. The dandruff is actually like a surface infection. It's an infection of the scalp skin more than the roots. But if the scalp skin is unhealthy, sometimes the dandruff or the dandruff gets a little way out of hand. We tend to have weakened roots, because of which, of course, there is this, again, telogen effluvium phase, or it can even go up to go into hair loss if we ignore it for a while. Dandruff also tends to have its associated follicle irritation issues. So we'll end up having itching on the scalp or rashes. That is when the dandruff again is ignored for a while, and randomly any products is used to, or even sometimes home remedies are used to take away the dandruff, and it does not go. So that can lead to a very aggressive dandruff, which sometimes tends to really stay and very difficult to treat. So for these very reasons, I think the moment you feel that you have dandruff, you should start addressing it from day one. And please visit your dermatologist so that they explain you the right way to use your shampoos, and what kind of shampoos you would need, and how frequently you would need to use those shampoos.
Right.
So we can avoid any kind of hair loss in future.
Absolutely. Well, thank you so much, doctor. Now that we have spoken so much at length, about hair loss, coming to the medical treatment options for hair loss, could you please tell our viewers as to what medical treatments are available?
When we come to med talk talk about medical treatments, there is actually, it could be actually by on its own a huge chapter, which I would not be really able to cover up in such a small time. But medical treatment composes of us applying medications topically on our scalp in terms of lotions and serums. And then we have supplements which we give to our patients to in addition to the topical applications. Or sometimes if the hair loss is very severe, we also have medical or some drugs which you can add to the list of treatment options. Now, depending upon what kind of hair fall it is, whether it's just a hair shedding or whether it's hair loss, and what the reason for the hair shedding and loss is, we can add treatment options, to give treatment options to the patients. So among them, when it comes to just hair shedding, wherein there's a increase in the hair loss from the routine, we advise the patients to apply serums or peptides which have redensil or which have liposyl around into the hair roots, or and that can be left overnight. These serums can be left overnight so the roots are nourished and hydrated. And following which, if the effluvium is very extended, the telogen effluvium is very prolonged and the patient just doesn't respond to topical applications, then we add micro or macronutrients depending upon the deficiencies. So many a times, depending upon the nutritional state of the patient or the healthy state of the patient, we get the patient tested for vitamin D or maybe serum ferritin levels, which actually tells us the iron content in our body, or we get tested for serum vitamin B12. So these are, and sometimes even hormonal tests are done depending upon the other symptoms of the patient or the reason for the hair fall. So if we have deficiencies of this, we always would add or like to add micronutrients or these deficient nutrients to the patient's treatment routine, along with the topical applications. Now we have things which are available in India, of course, available very well, OTC products which have minoxidil in it, and a combination of minoxidil with peptides and combination of minoxidil with finasteride, which is also helps us in our hair loss treatments. So these medicines can be given to the patients to apply topically in different formulations depending upon what the need of the patient is. But I would advise all my patients, please don't pick up these medicines off the shelves and start using them just because some of your friend is using it or it helped that particular person in their treatment. Please visit a dermatologist and get a specialist opinion as to exactly what your roots need and what will cover your hair loss.
Right. Absolutely. Well, thank you so much, Doctor. And Doctor, coming to this season that we are in right now, the monsoon season, a lot of people are generally not very happy with their hair during this season because of humidity, etc. So, Doctor, could you please share with our viewers a few tips on how to care for their hair during the season and how to avoid hair fall?
Monsoons actually can be very can be a big menace when it comes to hair care and hair fall or hair shed. So more than the hair fall, it's the quality of hair which gets disturbed. We tend to have more frizzy hair and we tend to have hair which are flying all around our head. So that happens because the hair holds a lot more moisture. The length of the hair holds a lot more moisture. So they tend to become very heavy and they tend to become very frizzy. The other reason why hair shedding is increased during monsoons is because the follicles, they are there's a lot of sweating during the humid weathers. There's a lot of sweating in the scalp which can be trapped and which can actually make the hair roots very weakened and loose and lead to a lot of hair breakage. So it's not a myth that hair falls during monsoons. Is actually again a reality. Like I was mentioning how COVID is a reality, post-COVID hair fall. Monsoon hair fall is actually it's actually a reality. And the best way to address is that in monsoons, please avoid oiling your hair as much as possible because already the oil is the hair or the scalp is overburdened with the moisture from the sweat. Secondly, frequent washings with very light, gentle shampoos. Avoid conditioners in this weather because again, there's already a lot of moisture in the air which your hair is which your hair length is attracting. So adding a conditioner to your routine will add even more moisture and could even lead to more frizziness or more breakage in the quality of your hair. So yeah, these factors are important when we talk about maintaining your hair during the monsoon season. And I think instead of getting worried about it, I think we need to be prepared that, okay, the monsoon season is here and we need to take care of our hair in these 1, 2, 3 steps.
Absolutely. Well, thank you so much. We got a few good tips there, doctor. Coming to some myths about hair care, doctor. So let's debunk some of the myths. Could you please share with our viewers some of the common myths that you have seen that people observe, but you would like to break them for them?
So we have, I see most of my patients whenever they come to my hospital, they come with a big load of, questions about oiling, about shampooing, about conditioners, hair spas, and, what should be done, how much should be done. And because they have a lot of mind blocks in their head about these issues. So as I was discussing about oiling, so oiling again, there's a common myth that oiling increases hair fall, but I like I was telling you before, there are two school thoughts about oiling. So you should just remember that oiling does not really prevent hair fall, nor does it really correct hair fall. But yes, it does only basically condition the scalp. So there is no harm in oiling. People believe oiling only during the monsoons. I would advise that minimize the oiling. Now, the second myth is about, if we wash our hair too frequently or more than 3, 4 times a week, our hair will fall or it will shed more or is exposed to shampoos and chemicals more. That again is a myth. You can wash up to 7 days a week. You could wash, 14 times per week, depending upon your occupation. Hair shampooing, in fact, sometimes makes our scalp more healthy, and it makes our follicles breathe better. And so there is a myth that frequent shampooing increases hair fall. That is, I would totally try to debunk that. Then the other query they have is about conditioners and whether it should be used. I already told you. So yeah, conditioners can be used practically on a regular basis along the length of the hair. Avoid using conditioners in the tips, in the roots of your hair. They can be used more from the length to the tip of the hair. And uh, it's very important part of the routine for people who have very dry hair, and it should definitely be incorporated. About hair spas, people have this thing that hair spas actually improve the hair growth, and it will help us in our hair loss or hair shedding. So that's not true, because hair spas at times actually have so many chemicals in them. They sometimes damage the roots of the hair more than they help. And instead of improving the quality of hair and improving the hair growth, they sometimes do the other way around. So yeah, hair spas as much as avoided, as much avoided as possible, please.
Hmm. Well, thank you so much, doctor, for elaborating so much on hair care. And this was indeed a very insightful session and very informative talk. So thank you once again for your valuable time.
Thank you, Deepti. And just
Well, ladies
one
and
part.
gentlemen, with that, we have come to the end of our live session. We hope that you found it informative and helpful. We'll see you again in our next session. Until then, please incorporate the tips shared by Doctor today and get healthy and strong hair. This is your host, Deepti Harvani, signing off. Stay safe and stay healthy. Thank you, Doctor. Thank you once again.
Thank you, Deepti, and thank you, Kalpana.